Let's go to the basic. For someone who buys the device and have a maybe severe chronic disease, what kind of advice would you give them? What kind of to start off with, of course, they know how to do. They probably watch my video how to unbox, and you have given them instruction in Chinese. But what 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 would be your advice for them? Like what to expect from this device? What they should be doing rather than just rushing in and go full out. What they should be doing.
Okay, first of all, I always ask the newcomers to use the ear clip because whether you're healthy or if you're a sick patient, it doesn't matter because the ear clip, the vagus nerve stimulation is good for everybody, whether you are old, you're young, you're sick, you're healthy. It is always the good thing about this ear clip is that it will stop the inflammation inside your body. As you know, many of you might know because I believe Dr. James has also presented that there are foods that actually cause inflammation inside our body. So when you have chronic inflammations, then it will make your body you might get a cancer eventually, or you might get a heart problem, you might get stroke, you might get Parkinson. These are all those sickness that actually caused by inflammations. And for your information, our eye dog, the ear clip, the vagus nerve stimulations is very good to stop inflammation. That's why I always insist that everyone should do at least for 1 hour per day. For those people who are sick, like cancer patients and stroke patients and all those serious disease, I would suggest them to do more than 1 hour because by stopping the inflammation inside your body, you are actually readjusting your body balance so that the immune systems, the self repair by stem cells and etc. it will be accelerated. So that's why the ear clip is a very good thing to start with, and it's quite easy. A lot of people may also experience healing crisis, but healing crisis is a good thing. That means your body is reacting to the therapy, the vagus nerve stimulations. So a lot of people, I always ask them, drink more water before or after, preferably warm water. Warm water would be very good. If you drink warm water before and after, and drink more during these vagus nerve stimulations, what do you call that? Every day. I mean, you increase the intake of water, it will be good, and your healing crisis will be minimized. Minimized meaning you don't feel uneasiness or uncomfortable, things like that. So, like I said, just do the ear clips, and then if you have further problem, of course, then we will have to do the electroacupunctures. Okay.
Okay. There are a lot of people who are very, very sick. And do you think that they are over expecting kind of too much, or maybe they abuse it? I mean, what would be your advice for people who are very sick? Should they start slow, or yeah, because the healing crisis will be quite severe in some cases.
Yeah, in most of the cases that I have experienced, of course, if a person is so sick, like for instance, cancer patients, whether stage 3 or stage 4, I would suggest them to, don't rush because you still have to start with the ear clips. So you can start ear clips even without doing diagnosis, because ear clip is generally to stimulate your vagus nerve, which is going to let your brain to function normally. To function normally meaning they should release those hormones and things like dopamine, serotonin, things like that, and melatonin, so that it can help your body to perform better in a better way. So that's why vagus nerve stimulation is very important. Whether you are sick, you are not sick, whether you have diagnosed or you can use it straight away. But for those patients who are seriously ill, like those people who are paralyzed due to stroke, or maybe very severe heart blockage, the artery, what they call that, the blood vessel block, or cancer patients, of course, then you have to be extra careful. So you don't start, you start with vagus nerve stimulation, then you do on the acupuncture point, the reflection zone accordingly on your hand, on the back of your hand. So you just do it accordingly. You don't have to rush. Uh, Slowly increase, because for those people who are critically ill, it might have the very very severe what they call that, healing crisis. So I normally, I would advise, you start every day with the vagus nerve stimulation, then you start with the electroacupuncture, but you don't have to like straight away go to number 10. You can always start with, two or three, then slowly, day by day. Yeah, day by day, you slowly increase the thing, so
Yeah,
that, the healing crisis will not be so serious, especially for those who are critically ill. So
yeah.
this is the advice. Like I said, you need to drink more water, before and after. Either or you can do it before or after. Either you drink more water before you do the therapy, or you drink more water after the therapy. Because most people, they will feel the body heat, if you don't drink water.
The yellow color points, yeah. You emphasize even when you diagnose these points. Can you elaborate a bit on why and the relevance?
Okay, I think this is a very good. This is a very good thing to learn. It's a very good knowledge in traditional Chinese medicines, acupunctures. Okay, those on your fingertip, the yellow point on your fingertip. Uh, these are the what we call the meridian in our body. According to Chinese medicines, there are 12 meridians. There are actually six on our hand and six on our feet. So the meridian is like a cable, it's like a highway. So if you start to do diagnosis here, then you will see what they call that. You can get an overall picture of your body. Let's say if you start with your thumb, that is the meridian point for your lung, and if you put there, and then you feel pain. Okay, that means your lung system. Lung system includes everything related to your lung. Is not only relevant to lung. Like for instance, asthma, sinus, these are all related to lungs. If you have a lot of phlegm, that is also, if you're coughing, that is also related to what they call that, your lung. So if your lung meridian feel painful, that means your lung is, the meridian is blocked. So when you do the diagnosis on your fingertip, especially on the yellow point, you can get an overall picture. Those people who are healthy, so basically they won't feel the pain at all. Then after I have done these 5 points, then I will move to those like I said, important organs like liver,
Okay,
kidney.
before you go on, you mentioned 5 points.
Yeah,
There are so many yellow points here. So which are the
yeah.
5 points here?
The 5 points are on your finger, next to your nails. The
Okay,
one.
so the
Okay.
thumb, the one on
The
the
thumb, yeah, you can see your
right
index
side,
finger. Yeah.
on the
The
yeah,
ring
yeah.
finger and the last finger, and these are there are 5 yellow points. You just look at it. So there are 5 points. Just do the diagnosis on these 5 points to check the overall health condition of the person. If the person is weak, or if the meridian is blocked, they will feel the pain. So if all of them feel painful, that means this person is very weak. He might not be sick, but he's a very weak person, we call it. So he might uh, uh, fall what do you call that, into a illness, or a sickness,
Mm,
very soon. That means this is a very weak person. Normally, if you do this diagnosis on a cancer patient, you can see, their energy level is very low. So these are the meridian that we check before I go into the reflection zone, which is on the palm. Okay.
yeah. So yeah, before I show you the palm chart for everyone. Uh, some people level 3, 4, 5 when they start is okay. Some people even level 2 or even level 1 is to what degree, I mean, does it reflect individually, or is it just the sensitivity of everyone?
Okay, actually,
Yeah,
for me, I mean, I usually use level two to start with for adult, but there are some people who has got very thick skin. Some people their skin is extremely thick. Then I will use level three. Number one basically is for the kid lah. That means those people who are under 12 years of age. I will use number one. But a lot of people, even adult, when I use number one, they still feel pain. That means something is wrong. Something is wrong. You
yeah,
got me? Yeah.
yeah.
So you shouldn't, you shouldn't feel pain if it's level one. For adult, normally it's level two. For those adult with thick skin, I use number three. So this is like, my common practice lah. So just share with you about my experience of using how I diagnose patients.
I guess every individual I mean, pain tolerance is also another thing. Some people, they can tolerate
Yeah.
pretty 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 high,
Yeah, but
but
they can feel because between each meridian they can actually feel. Some are stronger, some are weaker. So
yeah,
that is how they know.
yeah.
So if
But
they feel stronger sensation on their lung meridian, which on the tongue, and then they feel a lesser sensation on their large intestine meridian, which is on the index finger, then they will know that the lung is weaker than the large intestine. So you will know. That's why it's called DIY, because you cannot cheat yourself. The moment you put on it, whether it's painful or it has got
you know,
a higher sensation compared to the other point, then you will know exactly. Because for us, we have to rely on the feedback of the patient. Sometimes the patient, they don't tell you the truth. So if they tell you the truth, so it's very hard. But when you do it yourself, that's why I
yeah.
always tell people, please do your self-diagnosis. At least every month you do it once.
Just one question which is commonly asked by a lot of people. To what level do you feel that you are healed? Am I right, guys? You all want to know, right? Like, up to what level is considered healed, Like, yeah.
Okay, actually, I always tell the people that, let's say if you have some problem, your target is to hit at least number 10. If you do it on your finger or on your
Number 10.
thumb.
Okay.
Number 10, at least, because from the feedbacks from all those critical, what they call that, illnesses, patients like cancers and, especially cancer patients, when they do up to 10, and above, then they can see the what they call that, the big improvement on their condition. They know. Let's say if they have a lung cancer, so lung cancer, one of the symptoms, of course, the breathing is very hard. They feel very hard to breathe. But when they do the 10 and above on their meridian point, just within short period of time, maybe within a day or maybe 2 or 3 days, they can see the difference. They can breathe more easily compared, to before. So that's why I said, if you want to see the result, you have to use at a higher level. But of course, like I said, you don't start level 10 or 15 on the first day, because you might not be able to cope with the healing crisis. It is better for you to move slowly. So let's say if you start with level 3, so you feel pain, so start with that and slowly go up. Slowly meaning it might take you a few days or a few weeks to go up to number 10. But it doesn't matter. As long as you keep moving up, that is a good sign already. And
Yeah.
most people will see tremendous changes if they use a higher level. So that's why, like I say, I always tell the patients, no pain, no gain. If
Oh,
you
I say that all the time.
you're all right, yeah.
No pain, no gain.
If you cannot take the pain here, imagine that you have to go to the hospital, on the operating theater. That is even more painful. That's why I
Yes.
say no
Yeah.
pain, no gain. This is only a small pain.
Yeah.
So compared to those surgeries that you have to go through. So
And
that's why, like I say, like you must know how to use the device, because you have bought it, you pay for it already. If you don't use it, you don't learn how to use it. It's a waste of money. That's why I
yeah.
say, it's a waste of money. Some people they just buy and then they put aside, you know. So
Mm,
I've seen people in Malaysia, like, they just bought the thing and then they put aside. They don't even use it regularly. What a waste, man!
mm.
Actually, at least you should use the ear clips. You know, if you don't know how to use the acupunctures, the electro acupunctures, you must at least use the ear clips. So at least you gain something. Yeah.
Okay, I have some questions here, Dr. Bobby. This from US. I need to know how to treat the following acupoints, frequency, level, time. Okay, number one, leg and shin, our leg, the front, the shin, midnight cramps, which comes and goes. There are more, but I think for legs and shin and cramps, what is your suggestion?
Okay, first of all, let's say for the midnight cramp, one of the things that is very useful is our eye wave socks.
Yeah, I was about to say that actually.
Yeah, that is fantastic, man. If you feel pain, or always cramp, just wear the eye wave sock. Like I can guarantee you, you will see the result very, very fast. This is already from many of our users a feedback, you
I
know.
know. Same for
So
Philippines as well.
yeah, that's why I said you must know how to use the device and whatever, whether it's a soft or the device, you must know how to use it properly. Then you will see the result. If you
Okay.
want to, if those people with kneecap pain, okay, you can use the eye wave together with eye dog. So if you are using eye dog, so you can actually put the put pen on the local area, on your kneecap. That will stop the pain. If you wear the socks and do the local electro acupuncture on the local pain point. Yeah. That means if you feel pain on the kneecap, you just use the pen and do it. Yeah.
So you put the pad, I mean the sticky thing near the knee point, and then
Near
it's
the
a
knee point.
point.
Yeah. Because a lot of people they ask me, is eye dog only designed for hand? No, you can actually use it for your whole body. But because of it's a DIY, that's why our chart is on your hand, because sometimes it's quite difficult for you to use on your, like your shoulder, your back, But
So the only place you don't use is your face and your heart. I mean,
yeah,
as I
don't do that unless you are a trained acupuncturist, like I said. So if
yeah.
you are a trained acupuncturist, then you can do. So it is exactly like acupuncture. So but this is not invasive. That's a good thing. That's why
Mm,
even those people who are not acupuncturists, they can use it. Imagine that if you are using a real needle and then you put or you poke on the wrong place, there will be it can be disastrous. But for us, the probe pen, you can use it on any acupuncture point all over your body.
yeah.
Don't use it on near your face or
Yeah.
this is very important unless you are a trained acupuncturist.
Yeah, the second question from the same person, arthritis. I think Dr. Bobby doesn't have to answer that because here, guys, whoever it is, please show her where to find this arthritis chart and then
Mm,
tackle the green and then the blue and then the yellow points. Okay.
mm.
So
You can also do it on the local point. A lot of people, I always tell them you can do on the local point. That means if
where,
you
where,
feel
where it hurts, lah, local point.
Yeah, so just do it on a local point.
Go straight to the
In
point.
Chinese acupuncture, we call it the asu point. Okay, so asu point is where there's a the where the pain is. Like just do that.
Mm.
Okay.
And then for the lower back and all that, your spine, your lumbar, everything. Uh,
Uh,
guys, I mean, you just have to look at this thing that comes with your device. See,
mm.
the thumb, the left hand thing, all the way down to the coccyx. All right. So, anywhere which is painful, no pain, no gain. All right.
Okay, regarding the pictures, a lot of people, they because of that picture is not so accurate. So for the patients, normally I will show them, that if you look at the things, the middle, this is the part, which is your neck. So if you go down from middle, go down all the way, this is your thoracic, and then this is your lumbar. Okay, but if you look at the chart, it's like you putting on the side. It's not side. It's actually from the middle of your nail all the way down. This
Ah,
back. Okay, that's why
okay.
I
Pay
see many
attention,
people they are doing on the wrong point.
So don't, the chart is wrong. Or
It's not
actually,
wrong, but because of
trying to squeeze
it's a
in.
2D, it's not a 3D.
It's
That's why
not,
you
it's
see
not a
like
side
yeah,
view.
yeah, you it's like side view. No, it's actually in the middle. Okay,
Okay.
so yeah,
Yeah.
just to share with you, the other day when I was with Dr. Mario is from Cyprus, so he was in KL, so we were together. So I show him because he's a chiropractor, so he treats all these backbone problem, all these things. And then yeah, I show him our acupuncture point. He said, yeah, this is exactly what we are doing also as a chiropractor. So this is the right way, your thumb, the middle of the thumb. This is your neck. This is your thoracic, and this is your lumbar.
Okay, that's a very good point. Then another one is the help my daughter-in-law with her migraines. I think guys, we have headache and migraine points as well.
Yeah,
Then liver damage, we have liver points as well. Yeah.
yeah,
So another question, moving on. Lower back pain, I think that's the same. Yeah,
mm.
Bobby just talked to you about it.
Okay, for those people who has got like liver problem, beside on the liver point, you should also do the diagnosis on the five fingers.
The yellow color one,
The
yeah.
yellow color. Do on whatever problem that you have, whether you have kidney problem, you have liver problem, you have heart problem. Just do the diagnosis on the five meridians, so that you know that whether your energy level is balanced or not.
Hmm.
You
I
need
think
to have, yeah,
it's a good practice. What do you think? Like maybe spend a couple of minutes on each point. I mean, whether you are healthy or not healthy.
yeah.
I
That's
think
what we I don't normally I will ask the our what do you call that, our customers to do. I say you think that you're healthy, but actually you are not. So you have to do it. But let's say today if you're healthy, but it doesn't mean the next month you'll be healthy. That's why you can do regular checkup, whether every month or I would say like every month. Since you have got the device ready, why don't you do a simple check very fast on the five meridian point?
mm,
Sometimes when you have a flu or when you have cough, when you do on the lung meridian, you feel painful.
mm,
Sometimes if you have problem diarrhea, you do on your intestine, whether large or small, you can feel pain. So that's why I say the meridian is so important, because this is like the main cable, that supplies the energies to all our body, to your internal organ. Okay, this is according to Chinese medicine. Like I said, I always have to stress. Okay, it's according to
right.
Chinese medicines.
Pay attention. Pay attention.
Yeah.
The yellow points. All right. Now
Okay.
focus on that. I know a lot of us have been neglecting on these points and
Yeah.
go straight to the front, and then we have
Yeah.
me. So
Yeah.
that
The
what
actually this meridian points are actually even more important. That's
more
why I
important.
always ask people to check on this meridian, the five beside your fingernails, before you do anything. Okay. So at least you can get an overall picture whether you're healthy or not. You cannot cheat yourself. If you feel pain, that means something is wrong. If you feel a higher sensation comparing to the other meridians, then you know that this thing is blocked. So you need to unblock it, you know, and then after checking the five meridians, then you move to the area. Let's say if you have a liver problem, then you treat on the liver point. If you have a kidney problem, you treat on the kidney point. But before that, you have to do the checking. If you feel that two out of the five meridians are very painful, you also do the what they call that, the electroacupuncture on the 2 points as well.
Yeah. We have a member who is now on the way traveling to Italy, I believe, and she has been diagnosed recently, with findings, compression fracture due to osteoporosis. Okay.
Okay.
Yeah, and how to treat for osteoporosis. I mean, she has other lower back problem, but those are, I hope, we whoever is here related to her can tell her that instead of focusing on the side, focus on the thumb down, right? As what Dr. Bobby says.
Yeah.
Yeah, but for osteoporosis, what is your take on that?
Okay, for osteoporosis, that it also depends on your diet. During my Chinese sessions, I always tell people, don't spend money on those milk powder and also the calcium the calcium tablet. It won't help a lot. One of the best food for osteoporosis is the little fish. We use it to cook the soup. It's called anchovy. That is very good. I don't know whether you take that, but Chinese we love to cook. We love to cook the soup using anchovy and also sardine. Sardine fish is actually very good, especially those in the can. A lot of people say that the canned food are not so good, but canned sardine is actually a very good source for you to get the minerals, especially when because during the process they use a very high heat. That's why the bone become very soft. You can actually eat the bone, and that bone, will provide you with extra minerals. And this type of food, because it's a natural food, your body can absorb it immediately, and then to replace, to whatever part of your body that you have problem with your bone. Because unlike those milk powder or calcium tablet, it might, the absorption rate might not be so high. So that's why I always tell people take more sardine fish, whether it's a can, or if some of the sardine fish is filled with tomato sauce, and some of them is filled with olive oil. It's up to you. It is very good. And if you take it, not only that it will help the osteoporosis, but at the same time also, because of sardine fish is very high in omega-3 and coenzyme Q10, and it means that can help you with your blood vessels, with your brain as well. Omega-3 and coenzyme Q10, very, very high. The fishy smell of this sardine is actually the smell of omega-3. That is the smell of original omega-3. That's why taking sardine is good. It's cheap and it's good. It's much better than the calcium tablet and also those milk powder that claim that they can treat or fight osteoporosis. So, yeah.
Okay. Yeah. Another question is that is our TAVNS the only one in the market? My answer to that is no. Another popular brand is also called NeuroSim, right? NeuroSim. Let me show you the website. I mean, nowadays, guys, nothing to hide. Everything is transparent. You can go to NeuroSim, and because I'm in the Philippines, so they show the Philippine price. It's 48,000. Ours is 36,000, right? And NeuroSim, by the way, in US dollars is about $850. And NeuroSim is not even medical device, but they're selling at that price. All right. And ours, apart from the vagus nerve stimulation, TAVNS, we also have electroacupuncture. So
Yeah.
those we can unblock, and we have so much more. So it's really value for money.
Yeah.
Value for
Actually, in Taiwan, there's also another TAVNS. They're selling at double the price of our Aculife.
wow.
But it's just like NeuroSim. It's only a TAVNS, and it doesn't
So,
it doesn't
yeah,
it doesn't have the function of electroacupuncture. It doesn't have the detect function. The good thing about our device is not only we can do TAVNS, we can detect. That's very important. And then when you detect, then you know what is the problem. Then you go for treatment to relieve. So that's why it's so effective. You see, those people who don't know, this you see some people like, oh, I got liver problem. I just treat the liver. But sometimes your liver problem, the root cause might not be your liver. It can be some other problem as well. That's why I say, don't just, sometimes that you have problem with your stomach. Don't just treat your stomach. You also do diagnosis to
yeah,
find out, maybe there are some other blockages on your
yeah,
membrane as well. Yeah.
exactly. Holistic approach.
Yeah. Holistic approach. Yeah.
Yeah. So, guys, there's another question cut here. Eye wave socks, sticky thing on knee point for kneecap pain, probe on. I don't know. I don't exactly. I think what she's trying to say is that if you have a knee pain, you can put the probe near the knee and then go around the knee area. That's what Dr.
Yeah.
say. And wear the eye wave socks. That will help. Yeah.
Yeah, definitely.
Mm.
I don't know whether you all can see this one.
Mm,
Okay, this is one of the okay, I can't. Okay, maybe can you see it now?
mm,
Sorry, yeah. I, okay, what I will do is that maybe I will share it inside our Facebook group so I can take a look. Those people who has got kneecap pain, and according to many clinical studies, it's already proven that when you do acupuncture, especially electro acupunctures on the right meridian point, it will help your bone cartilage to grow again. Those people who has like when they get old, it's called degenerative. A lot of people their bone cartilage was exhausted. Okay, so but when you do electroacupunctures, it has already been proven by clinical trials that your bone cartilage can actually grow back again. I'm going to share with you all the acupuncture points for those people who has got kneecap problem. And nowadays, this kneecap problem is become so popular, very popular, because everybody will get old. When you get old, your bone cartilage it will become very very thin, and eventually your bone will rub with each other. That's why you feel the pain. So by doing acupuncture, you can actually help, the soft gel, your bone cartilage to grow, or to prolong the lifespan. So that would be a better way instead of just relying on surgery. Okay.
mm. Oh, age-related muscle loss. Age-related muscle loss.
Okay, actually, of course, to prevent muscle loss, then you need to exercise regularly. That's why I always tell people use the ear clip, go for a short walk, maybe 30 minutes, 15 minutes walk every day, and that will help you a lot. Just wear the ear clips while you're walking, so you save time. 15 minutes, 10, 13 minutes on the treadmill, or whether if you go to a park and go for a slow walk, that would be a good way to preserve your muscle. So you still need to exercise. You cannot say that I just use acupuncture, I just use ear clip, but I don't eat proper food, and then you hope that everything will be okay. No, it won't be. Like I said, if you want to counter this osteoporosis, you need to take a lot of these what they call that food rich in minerals. For instance, the fish, like sardines, and these are the things, because you still need to do other things as well. Not only like acupuncture itself is not enough, but of course, when you do it together, when you walk, you can do the vagus nerve stimulation together, so you will save a lot of times.
What is the safest, highest level can a person go uh, for the ear clips? I think there's no safest or highest level. Highest level is 15 for the ear clip. But like I said all the time, ear clip no need to be like so Superman. Just as long as you feel the tapping is working already. So
Mm.
every individual has a different level of tolerance. But from the hundreds and hundreds of people that I have met, the people whose immune system is very low, even number one also, they have difficulty. I don't know about what Bobby experienced lah.
Yeah, most people, those people who are very weak, of course, number one or number two, they can feel the difference already. But normally after uh, 1 month or more, they can always reach level 15. So yeah, just do until level 15, slowly go up, and you can see the difference. Yeah, if you feel pain, just if you feel pain, because everybody will have different threshold with different tolerance. If you feel pain, then you use a lesser level. But ultimately, everybody can reach level 15, and of course, level 15 is the highest, but it's still very safe. That's why you see, to get the certification of this, what they call that, our Aculife, as a medical device, you have to go through all these, clinical tests, and it's very safe. You don't worry, it won't kill you. Yeah, you
Yeah.
won't you won't get overdose unless you do it for many hours. I realize there are people who use the ear clip for too many hours, and then like they got the burning what they call that, skin. Okay, for those people who have got sensitive skin, what I will ask them to do is, maybe you can what they call that, moisture your skin with water, or you can put some what they call it, water-based lotion. So it will help. It will help better. And maybe after some time, some people after they keep using 15 level 15 for months, then after that they say, no feeling already. But actually, it's not to say no feeling. You get your body has become much better. You get used to it already. Now you can put some water to moisture your earlobe before you start to use, and that will help you also.
Okay, another question is what is this? Hang on. What is the recommended points for patient with meniscus tear who has undergone a knee fluid aspiration and physical therapy? Meniscus tear is a common knee injury of a C-shaped cartilage pads. Yeah.
Okay, for those people who has gone through all this surgery, we don't really advise you to use the Propan on the local spot. That means if you just what do you call that, whether you have an injury or you have gone through an surgery, the most I would suggest you to do is to use the ear clip. Don't put the Propan on your knee, or near the injured area. That is not the right way. If you haven't go for this what they call that surgery yet, yes, you can try to put on the acupuncture point. I will share the points in the Facebook, so you all can take a look and you can try, because many people they want to try acupuncture before they go for the surgery, because not many people love surgery. You have to suffer, okay? So they will try, and after trying, if they feel better and they don't have to go for the surgery, then it will be okay. But if you have gone through surgeries or you have tear muscle or whatever, please don't do that on the spot. You can do the ear clips, no problem.
Yeah.
Okay, thanks.
It needs to heal. It needs to heal.
Yeah.
Yeah. Just like if you have a cut, the cut also have to,
Yeah, so that's why don't put the pen on the spot, whether it's on your knee, on whatever place, if you have injuries or tear muscles.
Wonder Boy asked this question, Dr. Bobby. How
Okay.
how about low blood? Wow, 80 over 60, very low. We use TAVNS for that.
Okay, you can use
He's a stroke
TAVNS,
patient.
and there are also points for hypotension. Low blood pressure is called hypo. If you open the blue little booklet,
Uh-huh.
attached
Yes.
together with our eye doc, they are actually hypotension point. So
Yeah.
you can refer to that and do TAVNS. So it would help, because our friend from Seremban, our stockist for Seremban,
Our doctor,
he's a hypotension guy. So he said that after using our what they call that, follow the instructions, now his blood pressure is like almost 120 already.
wow.
120. Last time it was like 100 only, I think, very low, not
Mm,
more than 110.
mm, mm.
Okay, so
So
hypertension, you can follow the instructions, in the blue little booklet.
the little booklet that comes with your package, lah.
Yeah. So
Yeah,
there are many what they call that, different type of diseases
yeah.
is there. So you can take a look and also refer to the ebook that written by the Irish.
You use both as a reference.
Yeah, I think that covers enough already. Cover enough most of the what they call that, most of the diseases already. Yeah.
Yeah. Wonder Boy, this is the one, okay? Dr. Bobby is talking about.
Hypotension.
Okay? From the small little blue book.
Mm.
Okay. Metal implant, is it safe for TAVNS? Well, I've said it repeatedly, even with the stent or titanium, no issues, right? So
Yeah.
the only thing is when you have a pacemaker and you're pregnant and you're 3 years and below, there are many types of diseases. So it's very hard in one session to say for trigger finger you do like that, for stroke you do like that, for diabetes you do like that. So guys, I'm just going to ask Dr. Bobby a very simple but very important question. So for general overall maintenance, would you say the yellow points are the ones that, or should you focus on spend some time on your heart, your liver, your kidneys, what do you think would be important? Or I mean, everything is important. I mean, no, even spleen, or I mean, there's nothing not important, right? But
Yeah.
okay, uh, I don't know, because there are so many diseases. The thing is this: to stay healthy, what should a person do? All right, to stay healthy.
Okay, to stay healthy, very simple. First, you need to do the ear clips, the TAVNS, every day, at least 1 hour, okay, for a healthy person to maintain. Because the TAVNS will stop inflammation, especially chronic inflammations. So chronic inflammations will lead to cancers, will lead to heart problem, stroke, Parkinson's, all these rheumatoid arthritis. These are all caused by the chronic inflammations. So
Yeah,
doing the TNVNS daily will help you because as we are living in the modern society, we have to eat in some junk food every day, whether you like it or not. So
no
because you
choice.
don't you can't say that all my meals are organic foods are very nutritionist full of nutrients, but like I say, let's say if I'm taking a burger today because I'm working outside, so I have to take junk food, and we know that burger and the French fries will cause inflammations. What I will do is that I have to do TAVNS to stop it. It's like the food are creating fires in your body, and you need firemen to put off the fire, right? So you do it every day because the air, the water, the food that we are taking, the cooking oil, it causes all the inflammations of the body. So it's like when you start a fire, you need someone to put the fire away. So that's why this TAVNS is such a good thing. Of course, taking antioxidants, is also a good way, but antioxidants sometimes is too costly. People cannot afford to take it for long term. That's why a lot of people, when they take antioxidants, sometimes they feel better. Whether different brand, there are too many companies, too many healthcare companies in the market that are selling antioxidant. And then you realize that a lot of people, after taking these so-called very potent, super potent antioxidant, you get better because the antioxidants, you will fight the free radicals, because free radicals will also cause inflammation in the body. That's why after taking the antioxidant, but one of the best way, of course, is to use the vagus nerve stimulations. I believe that Dr. James has already shared some very informative information regarding this TAVNS, how it stops the
So
inflammation.
many
Actually, yeah,
diseases. Yeah, so
it
many.
actually it actually stops from the root cause, which the root cause of the all inflammation. So that's why it's so effective.
A kidney dialysis. You see, dialysis doesn't help the kidneys. Dialysis is only because the kidneys cannot filter, so the dialysis machine filters. Okay, so
Mhm.
dialysis doesn't help. It's not a treatment. Okay, dialysis is just to filter. So, in other words, your question should be a kidney impaired patient can use electroacupuncture or TAVNS. That should be the way, because the dialysis machine is only to help what the kidneys fail to do. All right. So we have kidney points, don't we? Right. If you go to the small booklet to the big booklet, we have kidney points, and also TAVNS is wonderful, wonderful, wonderful for your kidney. Okay,
And we have patients that have this CKD. CKD stands for chronic kidney disease.
yeah,
After
stage.
using Aculife acupuncture device,
Yeah.
and their reading become normal. You know,
Mm.
so it actually reversed. That means from a CKD patients, and now they become a normal the reading. That's why I said this thing is very helpful, especially in chronic disease, all these chronic disease. So, but you have to use it, you have to use it in the correct way, and then consistently, meaning like every day you have to do it. You don't you do it one day and then you rest for 3 days. So you might not see the result. What happened to a stroke patients is actually when your brain is lack of oxygen, then it will damage some of the your nerves. Okay, that's why stroke patients, why they can't move? Because the nerve is damaged. So nerve is so important to transmit or to transfer the signals from your brain to your organ, whether to your hand, to your heart, to all these things. It's like a cable, it's like the internet. So what happens is that if the cable is damaged, that means your nerve is damaged due to lack of oxygen. That's why the stroke patients, they cannot leave the hand or to move properly, because the signals cannot reach, to the hand or to their legs. For stroke patients, these are the acupuncture points normally for I would do. Points is very good. Okay, I want to show you the point here. It's actually here. If you press, it's actually below the muscle, because I'm wearing a long sleeve. You can't see properly, so you can use the probe pen and you try. It's actually in the middle, in the middle. So here to here, also in the middle. You try here on the stroke patients. It works very good, well for them. Of course, the TAVNS is also important because it will repair the damaged nerve inside your brain, that are shared by others, medical doctors, that they have done research on these, what they call it, TAVNS. So they actually tell you that it can actually repair the nerve. So when you can repair the nerve, so if the whether if you can repair the nerve, so there's very high chance for the patients to get back to normal. So first you need to repair the nerve, and in order for you to repair the nerve, of course, again, if not, how to repair. So that's why you see this TAVNS and electroacupuncture is so important that you do it. So your body will release more stem cell, then the stem cell will go to repair the nerve. So it might take times. The best, of course, is if the patients get strokes and then he get the treatment immediately. We have patients in Malaysia that the moment he gets strokes and then he used the TAVNS immediately. You know that after 30 minutes he can just move like a normal person. And when he was in the hospital, the doctor did the scanning on his skull, and they say, yeah, you got a stroke, but he asked the doctor, do I need to, stay in the hospitals, or you want to give me any medicine? Doctor said, you don't have to stay, because now you're exactly normal. But the patient told me when he got the stroke, he can't even turn his body, he can't even move. But after 13 minutes, that is like the moment he gets stroke, the wife do the TAVNS for him immediately.
They should keep eye dog at home.
Yeah, even for heart attack patients, the moment you know that there's an onset of heart attack, you just click the TAVNS on your ears immediately. Then the attack will subside. So it takes very fast. That's why I say this is like emergency. We have already a few cases. Some of the patients, one of the stroke patients, already a stroke patient, then he feel that he's going to get a second attack because he has experienced the first time, so he knows already. But they use TAVNS on these patients, and then just a couple of hours later, it become normal. Normal meaning he know that the feeling has gone. So if you feel numbness on your hand, sometimes you sweat, so uneasiness, yeah. So you just do it. You just do it. Just use the TAVNS, use it for a few hours. I think you will get normal again. So that's why I say this thing can save life during emergency, because most people don't know what to do if somebody, your family members or your friend get a stroke attack or heart attack. Most people, they get panic. They don't know what to do. All they can do is to call ambulance. But sometimes when the ambulance arrive, it's too late already. So IDOC is very good in emergency cases. But like I say, those patients who has already got strokes and already couple of years, these are the 3 points. This one in the middle and the side. If you press using your finger, you can feel there's actually like there's a hollow thing. This is the acupuncture point. 1, 2, 3. Okay, so this is where we treat the stroke patients. You don't have to rush, but this one is like you need to do it every day. Okay.
You have to be patient because some
Yeah,
people
yeah, yeah.
they've had the stroke for a long time. It takes time so to heal. All right,
Yeah.
there's another question here, Dr. Bobby. Will it help patient whose mobility movement get affected due to car accident? I think that could be.
Oh, this one. Okay, it depends on how serious the injury is. So, like I said, we can't. If we can use iDoc and if iDoc can improve, then of course it is good. But we cannot promise. It depends how serious is the because accidents. This is
Yeah,
this is
broken leg,
way beyond our control already.
beyond
I would suggest you to try lah. I mean, for the patients to try, if you are willing to try, because I believe he also tried every method already. Every single method already. So if either can work on him, that would be good.
Hmm.
Hmm.
Question is on the can you point the probe on the spine area, local direct,
Okay, you don't have to probe
neck down to
you
neck
don't
down.
have to probe the probe pen on the spine. You don't have to. You see, if you have back pain, do on this point. It's very, very good. Okay. And then
Hmm.
of course you need to do stretching exercise as well to relieve your back pain. Okay. Um, Normally, I don't, what do you call that? I don't ask the patients to do the on the local point. Okay, I don't advise them to do on the local point because first, it is quite hard. You try yourself unless you ask another people to do it for you, another person to do it for you. It is quite hard. You can use it. Okay, you can do it. Okay, no problem. You won't die
Yeah,
because this is very safe. Yeah.
for the probe, the Ireland Irish doctor, that manual, it says 15 days, stop for 3 days, right?
Yeah,
And then I've been telling people, well, to make it simple, 6 days, stop 1 day. So you
yeah,
have no problem, issue, right?
yeah.
Now, for the question for TAVNS, can you use every day or every week, stop 1 day? What is
Stop
your,
one day. Just stop one day. Your body need adjustment. Yeah,
can TAVNS relieve vertigo? Actually,
yeah. Of course, it
vertigo,
will.
yeah, and there's also vertigo points.
Yeah, there are vertical points, and they are also if you use DABNS, vertical points. I think basically is here the last finger and here 三焦 and also the small intestine. These two are basically for the ears. Not only verticals but tinnitus, or deaf. So you can try DABNS, the last finger, the small intestine plus the 三焦 meridian. These two is very good for anything related to your ear or vertigo, tinnitus, deaf, yeah, deafness.
Wow. Elnora, I just used ChatGPT. Can TAVNS help vertigo? I have to update my my TAVNS sheet. All right. The answer is yes. So the TAVNS can also help your vertigo. Oh, that's nice. Thank you. Thank you for asking.
Cancer patients, they ask about actually you have seen our many of the cancer patients are actually using our device and they see very positive result. Even the terminal stage cancer patients. That's why you see, when you get cancer and when you go and do a diagnosis in the hospitals, the doctors, the cancer marker or the tumor marker is actually checking of the inflammation, the level of inflammation inside your body. So you can say that all cancer patients they will have inflammation inside their body. So remember what do we use to stop inflammation is the TAVNS. So when your body have inflammation, so your cancer cell will grow faster, then you start to spread. So that's why for all the cancer patients, we ask them to do the TAVNS first. Plus, if they can do, then I will ask them to do a fasting, change of diet. You cannot take high sugar, high flour, high carbohydrate. These things will cause the cancer, what they call the cancer tumor cell to grow even faster. So you have to change your diet. So it's not like, oh, you use the ear clip and the cancer can cure. It's what they call that. You have to go in with multi directions. The diet itself is so important. You have to stop all sweet stuff. Uh, Sugar, flour, carbohydrate. These are the things, and even the cooking oil that cause inflammations. So first thing for critical cancer patient, because all cancer patients they will have inflammation inside our body. That's how the doctor diagnose you. They will diagnose you whether you are cancer patients or whatever. They check the inflammation level inside your body. So that's why I said this is very important to stop inflammation. That's why the ear clip is so good. Don't wait until it become cancer. Just do it and to prevent. And do you know that by doing this every day, you can actually prevent stroke? If you ask anybody, any doctor, how can I prevent stroke? And they will ask you, change your diet, lah, this and that. Am I right? But that is,
That's right.
yeah, normally they will say that. But do you think that is effective?
No.
One of the very effective thing is like you do the ear clip every
Yeah.
day for at least 1 hour. Okay, then you will see the result.
Mm.
We have a case here in Malaysia. So this lady by the name of Angela. Oh, she's not here tonight, Angela. So Angela, she's a diabetic patient. She's a cancer survivor. She's 70 plus. She's a cancer survivor. She's a diabetic patient, and okay, recently she went for this regular checkup at the hospitals, and the doctor found that her blood pressure at the at about 250. That's very high already.
Wow.
250 for a person at her age, who is a diabetic patient plus cancer survivor. They will get stroke already. They will suffer stroke already. 250. Normal people is 120. This is double. Okay, and furthermore, she's a diabetic patient, but do you know that she feel totally okay? Totally okay. Doctor asked her, do you feel blurred visions? Do you feel headaches and all? She said, I'm okay. But her blood pressure showed that is 250. Why the blood pressure shoot up so high is due to an infection inside her body. It's due to the bacteria, the infections that makes her blood pressure to go up. Okay, it got nothing to do with idol. But because of Angela is using iDoc every day for about 2 hours, and you know that the thing that if you keep doing, your body will release a lot of nitric oxide. It will soften your blood vessel. And as we get old, we know that hardening of our blood vessels, and that is very bad. You see, when your blood vessel get hard, and if your blood pressure is high, what will happen? It will crack. So that is why a lot of people, after 50 years old, when their blood vessel is high and the blood pressure is high, then they will have crack, and then they get stroke. But now, because of Angela is using iDoc every day for 2 hours, her blood vessel become young. Young means it's like rubber, it's become elastic. So if the blood pressure go up, it will instead of crack, so it will become like a balloon, it can stretch. So this is what we call a young, very young blood vessel. So even at 250, she didn't feel, headache, because most people at 180, 200, you will feel already. You can feel that the pressure over here, at your neck, you can feel already. But even at 250, she doesn't really feel anything. And there's no blur vision, because at 250, most diabetic patients, they will suffer the burst of the capillary inside their eyes already. So that's why they can't see, they get blur vision. And she's totally okay. That's why I say, how to prevent stroke. You do it every day. Just do the ear clip. This is the right answer. Not like, oh, you have to change your diet. You cannot take this. You cannot take that. I think that is too general. If you ask any doctors or any healthcare professional, they will tell you, you have to avoid this and that. My answer is very simple, because most of the stroke patients, if you do this one, you stop the inflammation, then you can prevent strokes. So please share this information with more people, so they at least they know how to prevent. Not to say like, oh, you cannot eat this one, you cannot take that one.
People who are hypertensive, 200 plus BP, they should use the ear clip. They should use the ear clip.
Yeah. Sometimes sometimes the ear clip might not lower your blood pressure, but it can soften your blood vessel. So even at a higher pressure, it won't burst. That's what we want, you see. I'm a heart failure patient. I mean, for your information, I'm a heart failure patient. I used to take more than 10 tablets per day. The other day, I met one gentleman. He told me that every day he's taking more than 30 tablets per day, because he's also a heart failure patient. Okay, heart problem. So I have to take more than 10 per day. Then when I start to use iDoc and all these acupunctures, the TAVNS, I slowly reduce my my drugs. These are all prescription drugs by my cardiologist. And then even after that, I stopped it for some time. I went back because I have to go back for regular checkup. They have to monitor my heart condition. Even if I stop, when I stop the drugs, and after using the TAVS and the electroacupunctures on myself, actually I feel normal. Normal meanings like I get back, back to normal. And then, but my cardiologist, they didn't realize anything. They still prescribed the drugs to me, but I didn't take. I just didn't take for more than a year already, and I feel even better. You see, for heart patients, especially heart failure patients, when we walk up the stairs, then you know already whether your heart is doing. And if you got, especially before that, I have swollen legs. Swollen leg is due to my weak heart. It cannot pump, so your blood circulation is bad. You will get swollen leg, and then and also water retention. It might go inside to my lung. That's why I see heart failure patients, they suffer a lot, and then that it's uncurable. Put it this way, according to my cardiologist, they say it's uncurable. So, but after using iDoc for I think less than 6 months. Then I really discovered that, my body is like fully back to normal. Back to normal meanings I don't have swollen legs. I can breathe normally. I can walk up the stairs, not only one level. I can walk up 2, 3 levels and I don't feel like, shortness of breath and things like that. Then I know that my body is okay. That's where I stop all my drugs. And after stopping all my drugs, all the prescription drugs, I feel even healthier. Healthier means
Wow.
actually all those drugs are making me, less energy. I don't know, because it depends on individual. Some people, they take the drug, they feel very weak. I'm one of those people. After taking the drugs, I feel so weak. But when I stop all my drugs, now I'm okay. And then, but I didn't tell my doctor. Normally, when you tell them, they say, oh, no, no, you have to take it. But my body is telling me I actually feel better after doing the ear clips and also acupuncture. So I'm back to normal. No more swollen leg, even if I don't take the drugs also. So for me, I choose not to take the drugs because I don't like it. It actually hurt me. It actually disturbed me a lot. Okay.
Do you think Dr. Bobby should come here once a month?
Oh yeah, man, yeah.
I mean, once a week is too much. Okay, but once a month, right? We'll have Dr. Bobby to answer all the
Yeah, no problem. I would love to share my experience. Yeah, because I think that, by sharing all these cases and about acupuncture and vagus nerve stimulation, we can help more people. We can save more life. Like I say, a lot of people don't know when you do this thing, you can actually prevent a stroke. And Angela's case already, proved that it actually saved her life. At 250, you cannot imagine a cancer survivor, a diabetic patient, more than 70 years old, and she can survive. Nothing happened to her.